Welcome back to the series of staying healthy in the COVID epidemic. So here I'm going to discuss in brief the definition and to explain on what is called herd immunity, which you are going to hear in due course, and the value of community testing for COVID-19 infection. So herd immunity is defined as using a mathematical models where in excess of 60% of the population has meaningful level of antibodies. So this is the test based on the antibody and the mathematical modeling to provide the information that more than half the population are having adequate amount of antibody. So what's the big deal on that? This herd immunity includes both for those who had the previous infection or vaccination. Of course, for the COVID-19, the vaccination testing in the clinical studies have just begun, so we will not have the availability of vaccines for a few more months. So having a herd immunity indicates that the epidemic in a given country or society or state will be dying down on timely manner. You can predict what's going to happen with time. Because there will be insufficient people without immunity are left over now, so the virus to attack and spread the disease the way it likes to do. So their spread is significantly and systematically going to go down when the herd immunity exceed 60%. So when it's reached close to 80%, the incidence of the COVID-19 will dramatically reduce, not zero, dramatically reduce, so that it will be very easy to control the disease on epidemiological point of view. Currently, there is insufficient information on any protection might arise from the COVID-19 antibody. It's too early, and there's not enough evidence, scientific evidence to show that these antibody actually protect these people against COVID. Secondly, there are a variety of strains of COVID-19 now emerging. Initially it was 3, then 9, and now we are talking about in excess of a couple of dozens or more varieties of COVID-19, which individually may have a different antigen, and thereby humans are producing different antibodies against this COVID, which may or may not cover the other type of the viral strains. So we don't know that information. We probably going to take another 3 to 4 months to answer that question. So in addition, it depends on the virulency of the virus and the protective level of immunity needed, because everybody is not the same. People with the older the age, they need a higher level of immunity to fight against viruses compared to young age group. As for example, the children are rarely affected with COVID-19, although they are getting exposed at their homes from other people, because they have a stronger and intact immune system to fight against this virus and eliminate them without overtaking by themselves. So those with a high immune system, we already discussed that they have the capacity to fight against COVID through their internal immune system, hormones, and the very potent peptides, antiviral and antibacterial peptide they produce, and that really helps them to get over this infection, just like any other flu or influenza. So in this patient, the virus disappears and they become non-carriers actually, but they do develop immunity against COVID-19. So what would be the consequence of secondary peaks of COVID-19 if don't properly control? This is a real concern, because once the secondary peaks start to develop in unpredictable manner in the community, especially in the rural areas, hospital, and nowadays is a really threat in the prisons, the shelters for people, and aircraft carriers, submarines, you name anything with a closed environment. Some of these has actually now more than 50% of the people in at least a couple of aircraft carriers have now actually infected with COVID, and exponentially growing, and ultimately probably 100% of the people in that vessel will get infected in the absence of strong protective measures. So the sharpened increases of COVID-19 rates, or the so-called peaks, in the absence of flattening these peaks and infection, have already strained the healthcare system and workers, other workers, essential services workers worldwide. So this will not only put burden and expose them unnecessarily to the disease and vulnerable to develop problems, and also to burden the resources. So that's the importance of preventing or controlling this so-called flattening the peak hypothesis, to prevent a large number of not getting infected, but it brought down so there's maybe smaller or even the similar number of infection occurring over many weeks, rather than everybody getting sick within about 2 or 3 weeks, which is what we call flattening the peak, which you may have heard or read on the papers. So the lack of precaution taken by the hospitals and the healthcare administration has unfortunately have led to large number of doctors and nurses are getting infected, and some indeed have died from this infection. So this is really unforgivable and very sad situation. Those who are trying to protect these patients are getting infected themselves. It should never have happened if they were provided with proper precaution from the day one. So there's an urgent need for escalating the efficient early detection and the diagnosis of COVID-19 in patients using viral nucleic acid RNA testing, which is the RT-PCR, and also can be used actually the chest computerized tomography, so-called chest CT exam, which is very characteristic of diagnosing the person with the pulmonary COVID disorders. So while cumbersome, these are the only way of established diagnosis. No doctor in the world can look at a patient and say that confidently that patient has COVID unless they are in the deathbed or in the ICU. So that's not the point of the healthcare system. Healthcare system should be designed to identify them early as possible before they develop significant symptoms, and to improve in the community the immunity itself, so that the people will be much more resistant to develop COVID-19, and they don't need the healthcare facilities to take care of themselves. So lastly, in this video, I'm going to talk about briefly on the expanding the community-based testing, why it is so essential and unfortunately not being done. So no matter how we look at the statistics, the findings underscore the importance of expanding the PCR-based testing, not only in the hospital, but even more important in the community, to identify the people who are infected carriers roaming around in the community, to prevent the secondary spread happening. So without such a proactive diagnosis testing done in the community, there's no way any restriction or curfews or lockdown is going to solve the problem. It's absolute myth, and overconfidence can lead to major disasters of these countries who are relying on curfews and such. Basically, it's unproductive restriction. So, in the intention of the control of the disease, this is logical path must be taken. Enhance the testing, not only in the hospital, not only in the community quarantine centers, but more importantly in the communities itself, and prevent the disease happening and control at the community level, and prevent them coming into hospital unnecessarily. So that's the most important thing. Unfortunately, virtually a handful of countries are doing right now. With the community-based testing, those who are positive should be indeed isolate in their own homes preferably, or in the quarantines, or in the segregation facility in the quarantine center, or admit to the hospital if they have disease manifestation or signs. So these data also highlight the importance of always using the face mask when you get out of the home until you get back home. And it should be mandatory in all countries. Again, only in the few areas, few states, even in America, it's actually mandated using face mask, as in California. It's also important to prevent the gathering of people more than 2, not 20, as claimed by some groups, due to any reason. There's no reason to have the community chat or getting together to discuss whatever it is. It can be done over the phone, and the adhering to the broad social distancing intervention and following the community and the health department guidelines in your own country. So these are new findings happening within the last week to 10 days, with a large number of infected people otherwise never would have been detected was being identified. So this lead to two things. Firstly, the death rates are obviously going to get lower and lower, and the number of infected people are going to be extremely high rather than claiming numbers today. So meanwhile, the number of infected people will continue to increase linearly, not exponentially, but at the same time, the death rates are also going to get higher. Even though the death rates are lower, the number of total deaths will continue to increase. So finally, in addition to expanding testing, with this, what I mentioned with antibody testing, for example, highlights the need of a continuous, vigorous prevention program to control this disease. Most of the countries, what they are doing now, although good, are insufficient to control the secondary peaks. The most certainly include the ways to improve the immune system in the individual, in the entire country. There are ways of doing that. We'll address that in another video. And the previous videos I have touched in this matter in staying healthy. In addition, the new data emphasize the need of additional proactive measures for preventing the disease in every country. Until the next video, thank you again, and please come back.